All right, we're going to do a routine GYN transvaginal ultrasound. So the probe is in with the notch pointing up, and we go longitudinal, and we see the uterus. And we're going to zoom in. This is the zoom button. Zoom in. Too big. I'm going to get exactly lined up longitudinally. And then I use the split screen for the uterus for measurements. This is how you freeze the first screen. Then I go transverse. I rotate clockwise the probe and get an exact transverse image mid-fundal. And I do look for a septum by going up to the top of the fundus. And if you see the endometrium split, then you know there's a septum, and it actually looks like kind of a little septum there. And I'll back up, I'm mid-fundal, transverse, and I freeze the freeze button here. Okay, and then we push calc. The green bar is on uterus. I roll the roller to put the cursor at the top of the fundus. I push the set button, this gray bar. I go down to where I think the cervical uterine junction is. And push the gray bar, set. I get a new cursor. I put it at the anterior edge, set. Posterior, set. A new cursor on the other image, the side for a transverse, set. Go across, set. I've got all my uterine measurements, including the uterine volume, which we record the uterine volume. P1 saves this whole image. If you want to make a picture, you push P4. It prints a picture. All right, we have that. I'm gonna unfreeze. I'm gonna go back to the single image. I'm gonna go back to the uterus, and then we want to describe the uterine position. Her uterus is anteverted because the fundus is over to the left, the cervix to the right. If it's straight up and down, that's midplane. If it goes the other way, to the right, that's retroverted. Hers is anteverted. If it looks bent, it's anteflexed. If it's bent the other way, it's retroflexed. So that's anteverted, maybe anteflex, because there is some angle there at the cervix. You can see that. So now I'm gonna make it a little bit bigger. I'm gonna freeze it, and we're gonna measure the endometrium. I'm gonna push calc, and I use the little roller here to go to endometrial thickness, and I just push the little roller. That sets it on endo thickness, and I have my cursor. Set is this gray bar again. Roll it down. Set. I have uterine endometrial thickness. 1 point rounded up to 1.5 millimeters. Save the image P1. So her endometrium is thin. I'm gonna unfreeze it. I'm gonna just examine it. I think she does have a little bit of a septum. I can tell because when I roll back and forth, the endometrium goes up here to the corner, then back down, rolling back to the other side, it goes up to the other side. So it's a kind of a Y-shaped top to the endometrium. And then she has a fibroid. We can see a fibroid right here. And I'm gonna go ahead and mark that. I'm gonna split the image to look at the fibroid. And that fibroid is intramural left, lower uterus, intramural. This is the set button. I'm gonna turn transverse and freeze. And then push calc, and I'm gonna roll down to fibroid right there. Then I push the roller, and I have my cursor. Fibroids get 2 measurements, not 1, not 3. There's 1 measurement, And then I'll go to this other image and do another measurement. Set, roll, set. 2 measurements. I get fibroid 1. I've got 2 measurements and an average measurement, and it even gives a volume. So I use the average measurement as the size of the uterus, 10 millimeters. So a very small fibroid. And I'll record that with P1. And I'm gonna unfreeze and go back to a single screen. And I didn't do the cervix. I'm gonna look at that. I get lined up longitudinally on the uterus, and now it even looks more anteverted. And I'm gonna freeze, and we're gonna go to back to uterus, cervix length. I'm pushing the roller. I roll to where I want the cursor, and then I push it to set it there. And now I'm gonna set the cursor here where I think the upper endocervical canal is, and then roll down to the cervical os, which is roughly right here, and set there, and I have the cervix length. Hers is short, 1.9 centimeters. Average is about 3. I'll record this P1. And then unfreeze, and we're pretty much done with the uterus. We've done the position. Oh, I always gauge the quality of the image. This is a good quality image, so we'll say 5. I do it on a scale of 1 to 5. And almost everybody's a 5, some are 4. If you really can't see very well, I say 3. So we did all the uterus, qualities, measurements. Then we look at the cul-de-sac back here. There's no fluid. I don't see any nodularity in the uterosacral ligament areas here. I'm sliding side to side. I don't see any of that. I don't see any fluid, which would look black. Then I'm gonna go up anterior. I'm gonna look at her bladder. That's the bladder contour. Is generally normal. If they have cystocele, the bladder comes down like that. Down is that way. And then I'll look at the urethrovesical junction right here. That's the urethra. Bladder, urethra. And we can do a measurement of the post-void residuals. She just went to the bathroom. We measure and see how much urine is left in the bladder. Let's do that. I'm gonna split the image. I'm gonna push the set button, the bar. I'm gonna turn 90 degrees, try and get a transverse image, and push freeze. For this is different, you go to caliper, push caliper, roll up to generic volume, then you have to roll down to 3 distant. You're gonna measure 3 distances. I have my cursor, set, roll, set, roll, set, roll, set. And I just take an average of this, roll, set, and I get a volume of 3 cc's. So she has almost 0 post-void residual, good at emptying the bladder. Then I'm gonna push P1 to mark that, or to record that. And then we'll go back to single screen, and we're gonna look at ovaries. And just in interest of time for the video, we'll just make 1 ovary. So I'm scanning, and I'm over in the right ovary, and you have to scan around. I usually get a smaller view to scan around. This is the iliac vessels. You can usually find that. The ovary is very commonly right around there. And I can see the ovary. It's that dark oval shape. Sometimes it's mid-range echo. Sometimes it's actually lighter. A lot of ovaries are darker. I'm gonna split the screen for the right ovary. The set button. I'm gonna turn 90 degrees and get a transverse view like that. And then calc, roll up to right ovary, click it, roll the cursor, set, 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 roll the cursor, set. I've got all my measurements of the right ovary, and it gives a ovarian volume 2, P1 to record. And then I'm gonna look closer at the ovary with a single screen, because it looks like there's a simple cyst. And there is. And I'm gonna freeze that. And we'll just do caliper to measure a cyst or any other finding you want to measure. She's got a 11 millimeter simple cyst, and we'll push P1 to record. All right, so that's it. We'll go over and look at the other ovary. There's actually probably another little fibroid there. I'm getting a really good view. Yeah, it looks like 2 fibroids. Let's go find the other ovary. It's really a good quality image all of a sudden. Yeah, so this is her left ovary. I'm gonna split the screen. I'm gonna select. I'm gonna turn it 90 degrees and do freeze, and then calc. It says right ovary. I'm gonna click it, and then this changes to left ovary. This toggle switch here, it's on left ovary. I'm gonna do the measurements. Roll, set, roll, set, roll, set, set. There's the measurements for the left ovary. We'll record that too. So that's it. All right, we're all done. If you want to do color Doppler, you push CF, color flow, and you can roll the area that's being viewed with the Doppler. We'll color view her right ovary with the small cyst. And it just shows the Doppler blood flow in the iliac vessels and a little bit in the surrounding vessels. No abnormal blood flow inside the ovary. So a benign, simple 10 millimeter left ovary with normal Doppler flow. And we can record that too. If you want to, you can make a couple, undo the color flow. You can make just a parasagittal view of the uterus. I'll freeze it, save it, unfreeze, do another parasagittal view, and we did everything. All right.